I think the most important thing in trying to start and learn to do this procedure is you have to decide, okay, I'm going to jump in and do it. Okay, you can't just tiptoe in and try to do this procedure. And that's what I did. So I decided, okay, I fully believe in this procedure, given the data that was out there for it. And so I started promoting it to any of my patients who were on multiple medications, who were on advanced glaucoma, who I used to send to the glaucoma specialist, or anyone who just I knew wasn't going to take their eye drops. And so by doing that, I was able to get lined up a bunch of patients from the very beginning. And so I think the learning curve is you have to do a lot of procedures in a very short period of time, so that when you first start and you are having some trouble, that you can learn from that quickly and advance beyond that. I think you have to do probably at least 10 procedures in a short period of time to get over that hump. And that will also allow you to see, you know, when you break the window or when you're not able to cannulate, what to do in those situations, or what not to get so nervous about. Because there were plenty of times early on that I was not able to fully complete the procedure, yet the patient did really well. And when you saw that the patient did really well, that made me more confident to do more patients. So I only started doing this 6 months ago. In the 6 months, I've done almost 50 cases. And each week, I do anywhere from 2 to 4 cases. And I think it's been great for the patients. Almost every patient that I've done, the pressures comes down, well, certainly the first day it's usually in the single digits, and after that, most of them stay in the teens.
Amazingly, I think my experience with canaloplasty started from the wet lab. In experiencing the team's effort and certainly their confidence in myself in dissecting in a cadaver eye with a little bit of assistance from the team, and right off the bat I was able to cannulate the canal and have a full 360 cannulation. So that really enforced some of my skill sets that I already learned from trabeculectomy and transitioned me into canaloplasty very easily. The fear of finding the canal is always one of the concerns that most primary surgeons or initial beginner surgeons have. But once that wet lab and the initial training period is transpired, that it becomes very monotonous and routine for us, and we can really compress this case into a 30-minute procedure. So it's been very successful in my hands.
Another question that comes up is the learning curve. And it also comes up with the perception that canaloplasty is a difficult procedure. And from my perspective, if an ophthalmologist can learn how to do phacoemulsification, then they have the same skill set and they can do a canaloplasty. And it requires what I call structured and focused discipline to learn how to do it. I still had the anxiety when I was still initially learning to do the canaloplasty about the questions that come up. Will I be able to find Schlemm's canal? Will I be able to pass the catheter? Will I be able to get a stent in? And I've found that I've been able to find Schlemm's canal 100% of the time. And you hate to say 100%, but I think that's the honest to God truth. The number of times where I have not been able to pass the catheter 360 degrees has probably been, 1 or 2%. So it's very unusual once you found Schlemm's canal not to be able to pass it all the way around. The notion that canaloplasty is too difficult of a procedure, I think, is inflated. I think that if somebody wants to learn a canaloplasty, it's certainly within the realm of the majority of ophthalmologists. It's been said that I'd rather have and teach a doctor who has a good attitude compared to a doctor that has a good pair of hands. So a lot of it is dependent on the doctor's commitment and their excitement about learning how to do these newer procedures. There's a lot of us out there who mentor doctors and it's done in a very unique and supportive way, and I think it's a good program to take advantage of.